Nursing here at Elkhart General is a true vocation. Our culture allows nurses to explore and practice different avenues of nursing. We encourage them to bring a higher level of nursing care to their patients. That's the bottom line. We're all here for the patients. Elkhart General is a very high-quality institution. We breed commitment to our patients into our culture here. We practice our passion and our vision for our community.
I believe that Elkhart General is a community hospital that cares about every patient that walks through the door. I have been in larger hospitals. I have seen nursing care that is not any better than here. We may not be the largest healthcare facility in the area, but we do give the best care, and being able to work in several different departments has afforded me the opportunity to know how other departments function and share knowledge and expertise so that we don't function in silos. And we very much try to pass along to our counterparts what we're doing to make improvements, and then we share that house-wide through both nursing and the manager-director group.
Everyone's important. When I walk into a room as a nurse assistant, I put my number on the board, and I tell everyone in the room, if you need anything, call me. Not just the patient. If you're thirsty, I'll get you coffee. You want some ice? I'll get that too. I want you to be comfortable while you're here. During clinicals a couple days ago, they gave the patient a comb, but her hair was like mine when it wasn't dreaded, really thick and curly. And the teeth broke out. So I went to the gift store and bought her a thicker, sturdier comb. She wanted to comb her hair. You know, it was $1. But she'll always have a good memory that someone took care of her and got her what she needed. And that's how you treat people. Dignity, respect, honor their wishes, get them answers, get them information. Like it's your own mother or father sitting there, you know. That's what you do.
Even though it's considered a small community hospital, we are growing. We have excellent staff and support staff. We have not given up any of our support areas and thrown more work on the technician or the nurse. We're able to feel comfortable enough that we're supported so that the staff can take care of the patient. We have a great manager group and director group that helps take care of a lot of the details, so that if we are busy, we're able to stay with the patient. If they choose to participate in other activities, then a lot of times we will make sure that there's someone to replace them so that we know our patients are still being taken care of, so that we can participate outside of our area as well.
They're trying to look at what the needs are for their nurses. Like, they really would like to be educated and stay on top of things. And so they're always looking for avenues to do that. And they provide tuition reimbursement. You know, you can apply for scholarships. I recently got my master's and I got reimbursement from the hospital for tuition reimbursement, plus I got a scholarship from the foundation. So it really helped.
Our information systems are heavily technical, and we have a clinical informatics team that is all nurses. Equipment selection around here doesn't matter where we are. We just looked at some lifts for some heavier patients. We involved the staff to go look at those systems in Chicago. End-tidal CO2 monitoring is a brand new thing that we're actually the first in the region to provide for patient care around here. That was heavily driven by nursing from a patient safety perspective. So we try and engage the staff here because, again, ultimately they're the ones who have to use these tools. It's not going to be me. And so it has to make sense for them. And even when we get something, it isn't just about getting the equipment, it's making sure people are adequately trained, prepared for it, and that they succeed in actually using it to its most effective nature.
The critical care educators that we have are superb. They are well educated with advanced degrees, and they are also published. There's a lot of evidence-based education that goes along with that, not only in the critical care area, but also in this hospital. There are cardiologists that do research projects continually, so we are on the cutting edge of all kinds of education and research.
I think the most satisfying piece of my job is when a new piece of equipment comes out that is patient related, and you work so hard at rolling it out and training staff, but then to actually go into the patient's room and see it help the nurse and help the patient. I just had a situation yesterday with a patient. They needed advanced monitoring, and we used our brand new monitor, something we've never used on my specific unit. And the nurse, she said, "I am so glad we have this now, because I feel so much more confident. I can leave the room knowing that that parameter was getting watched." And that patient's family member said, "Hey," because he watched what we were doing with it, and he kind of understood what we were doing. He's like, "All right, now that that's hooked up, I'm going to go take a break in the cafeteria because I feel better about that." And that is so wonderful to hear, family members and patients and staff feel more confident in their clinical care that they can offer.
Living in Elkhart, I think we have the best of both worlds. We're a smaller town, but we have places nearby. Chicago's not too far away. Indianapolis isn't too far away. So if people want the big city, nighttime, weekend fun, it's not too far away. But then here at Elkhart, we're small, people know each other, your words mean something.
I think it's a wonderful place to raise kids. I think they have excellent school systems here. Again, we grew up in Middlebury, and it's more of a conservative area, but the learning opportunities are great. They're very involved in sports, and I just think education here in Elkhart County is very good, and we're very lucky.
The countryside here is pretty spectacular, I think. Clean farms, beautiful flower gardens, and then all the festivals. And the fishing, the salmon fishing. That's just going to get going in the St. Joe River. So we were up at the Betsy River 3 weeks ago and caught salmon. You think we're in Oregon, but here you are, 3 hours away from here, sitting in a river, bringing an 18-pound coho salmon.
The critical care internship program has been amazing. We spend 2 days a week in class. So we go to class for 8 hours, and they go through system by system, and we're able to learn what it means to be a critical care nurse. And then we get 2 days a week on the floor so that we're able to apply that knowledge and really put it to work kind of in a real life setting, because I come to work every day and I am still amazed that I'm getting paid for this. That it's a lot of fun, and I know that they put a lot of effort into hiring us new grads and getting us up to speed in critical care.
This is my first healthcare job, and reading about it in school, and you get the textbook explanation, but to make it tangible and see things in motion puts everything together. I can't wait to be a nurse here. Seeing the other nurses in motion, they motivate me, they teach me, they understand where I'm at in my education, and at this stage of life, where some places that I've done clinicals, they're more intimidating, and it's kind of like I'm a hindrance. I'm a welcome addition here. And I can't wait till I can give that back, till I can help them do their job fully. My scope of practice is limited, being a nurse assistant, and I'm studying to be a nurse. So once I'm done with school and I've graduated and everything, then I can give back to them what they gave to me.
There's all kinds of rewards when you're taking care of people. It could be the heart attack in the middle of the night. It can be the relief on somebody's face when you tell them you're done. It could be somebody out in the waiting room, pick the day.